Good afternoon, everyone here. Now I am going to discuss with you a recent published abstract, which is the efficacy of oral Acetyl Cystine in preventing post-ERCP acute pancreatitis, which was a randomized controlled trial and accepted in Asian Pacific Digestive Week conference by Dr. Tran and Beijman and their colleagues. Happy now to start the description of the study. We have no conflict of the interest. Post-ERCP acute pancreatitis is the most considerable adverse events which happen up to 40% of the cases in high-risk group. There are some agents such as indomethacin, magnesium sulfate showing the effect on preventing the both the ERCP pancreatitis, but the data are not homogeneous and the mechanism has not been proved. Acetyl Cystine is a common and cheap and good tolerated medication, and its efficacy in preventing post-ERCP pancreatitis not have been comprehensively established. This randomized control trial aimed to evaluate and compare the role of substitutory indomethacin and non-acetyl cystine in preventing the post-ERCP pancreatitis. We are, as mentioned before, this is an randomized controlled trial. We are taking this patient from 7 referral centers, 4 countries. They are divided randomizedly into 4 groups. Group number 1, which receive oral Acetyl Cystine, group B, which receive rectal indomethacin, and group C, which receive Acetyl Cystine in addition to indomethacin. Group D, which receive water as a placebo. We tried to assess the rate and the severity of any post-ERCP pancreatitis as a related parameter were analyzed and compared. Table number 1 shows that there is no demographic statistical significant difference between the male or the male and female or the age of the contributing patient, even the indication of the ERCP in the different patient. Ethnic backgrounds of the participant: about 60% of the patients were Caucasian and 20% of them were Asian. Only 10% were Arab. The indication of the ERCP, which variously, the most common one, 66% were CVD stroke. The summary of the result, as I mentioned before, according to the divided patient into 4 groups. The group number 1, which is the contributing patient, 84%, 84 patients. The percentage of post-ERCP pancreatitis is only 10% of the patient develop acute pancreatitis, 10%. Group B, which receive rectal indomethacin, which about 138 patients, and develop post-ERCP pancreatitis, 17% only. Group C, which receive indomethacin in addition to Acetyl Cystine, receive only 7.8% of them receive pancreatitis or develop pancreatitis post the ERCP. Group D, which receive water as a placebo, about 95% of 95 patients, only 20% of them they develop acute pancreatitis. Our conclusion: oral Acetyl Cystine played a more significant role than the rectal indomethacin, and the combination of both shows the best results that suggest synergistic effect in preventing post-ERCP pancreatitis. As I mentioned before, this is accepted as an oral abstract presentation in Asian Pacific Digestive Week. Goodbye and good luck. Salam.